So don't medicate and don't worry about cholesterol if you don't have plaque. But if you do have plaque, that is your single most important modifiable risk factor with medications alone. Okay. So that's a really important concept.
But I get this, but this is even a mind twister for me.
You know, unfortunately, it's a mind twister for a lot of people because the waters have been incredibly muddied uh, by misinformation. And I spend a lot of my day trying to unspool bad data for people because there's a very saturated message about what a healthy diet should look like. And if I had to summarize what I think a healthy diet looks like based on the data, is eating foods as unchanged from nature as they come. Now, that includes plants, that includes animal products, that includes eggs, that includes butter, that includes ghee, that includes all these things, right? But processing and altering and trying to be smart by extracting seed oils and let's mash this together and make this product. And surely there's a lot of hubris there, right? Because humans have been eating a certain way for tens and hundreds of thousands of years and have done just fine, frankly, in terms of lifestyle problems. They had other problems like infection, but lifestyle they were fine. And then we started processing and manufacturing and messing with the food supply. And also when it comes to meat and animal products, don't forget the way you treat the animal translates into the quality of that product into what you eat. And so quality of food is everything. In other words, if you look at the randomized control data, I know there are very strong camps that say plant-based everything, right? There's very strong camps that say keto everything. There's
Yeah.
people paleo. Frankly, I don't think any of those people are wrong or right. I actually think there are many paths up the mountain to health when it comes to diet, but probably one of the unifying concept there is eat whole, unsullied food as close as it comes to its natural state.
Wow.
So if it's yogurt, you eat full fat yogurt. And if it's plants, don't grind them up and make bread. If you're going to eat nuts, don't extract the nut oil, eat the whole nuts, don't roast them. All these kinds of concepts. That I really think is a much more important principle. But you can also drill down into what someone's diet should be for that individual in front of you, because people are heterogeneous, by doing appropriate blood testing. So for example, if you see someone with high triglycerides and low HDL and high fasting insulin levels, maybe high glucose, a lot of inflammation, guess what? That person is hyperinsulinemic, or they have insulin resistance, or they have metabolic syndrome, all kind of the same concepts. And so that person is eating too many carbohydrates for their genetics.
Yeah.
And so that person in front of you should probably eat a carbohydrate reduced diet. Now, should everyone? No, because people are heterogeneous, right? But again, one size fits all doesn't need to be that way in modern medicine. We have the tools, we have the testing capabilities to sort of figure out the individual in front of us. So, look for plaque, understand if they have disease or not, and then use testing and give some sort of rational advice that has data, and don't be dogmatic about stuff that doesn't have clear data. I mean, that's also a part of it, right?
So I get it now. I use all this stuff with my patients every day. So
Right.
that's incredible. Now let's wrap up. Let's wrap up this in because I want this to be palatable, no pun
Yeah,
intended.
you
With
got it.
people to take it.
You
Because so
got
many
it.
people are going to see this and they're going to take it to their doctors and they're going to
Right.
they're going to really digest it. No pun intended. Again, for
Right.
them, because
Right.
in the end, diets don't work. It's a four-letter word. Someone told me that a long time ago. And you have to live sustainably.
Yeah.
And when people in our country in Western civilized world and in all countries, it's essentially we our palate tells us to eat from 20, 30, 40,000. We eat and we love sugar and salt and fat and we eat and it feels great. It's sexual. It's actually, I had
Right.
an older guy once tell me, when he said he was in his 70s, I'm 60, almost 60, so I can't say it's old. And he said, don't stop putting me down for my diet. You keep starving me. Whoa, I was a primary care doc. I said, sir, I'm so sorry.
Right.
He said, doctor, we don't have sex anymore, or please, It's not really part of our life. I look forward, he said, to eating with my family and every day, and it supplants sex. So don't
Yeah.
starve me. You can do it. You can live on this crazy diet, Dr. O'Connor, but I'm not doing. And I now, Brett, I never forget, Dr. Nolan. I'll never forget. This man attacked me. I thought I was going to get sued for giving. But people love sustainability. So
Yeah, yeah, but Tom, I have to say, I completely agree with you. If you look at the French or the Mediterranean or the Greek or the many other cultures, I don't, those are a few examples. The way people eat is they honor food. They sit down with family and friends. They eat delicious food, but they don't overdo it. They take their time. uh, that is what food is supposed to be. You're not shoveling stuff into your face. At the same time, you shouldn't be starving yourself. It saddens me when I see people in my clinic, and to be honest, it's often men who are being ground to dust because they believe that eating something like red meat is going to kill them, and all they want is a delicious grass-fed steak that's been well prepared, and they can't have it.
but
And
this is great news. So you're a cardiologist, a lipidologist, and you're saying we could have steak. Which elaborate on
right,
this?
right, but at the same time, if you are vegetarian and that's how you like to eat and you get pleasure from that, eat like that too. In other words, the label of the diet is so much less important than the quality. You can eat vegan Oreos, and those are terrible for you. You can eat keto salami dipped in soybean mayonnaise. That's terrible for you, right? It's not the label that's important, but it's the quality under that label. So you can eat an immaculate plant-based diet if that's what you like, and you can live very healthily. No problems with that. But should you? Is it the best diet out there based upon the data? No, I'm afraid it isn't. There's space in the dietary world for all of these things as long as you do it with good basic principles, right? So I wholeheartedly agree with you. I don't think we should be denying people. I think that happens more often with the traditional advice than with sort of more honest contemporary advice,
You
frankly.
can't argue when you look at the death rate, the mortality, morbidity of heart attacks and strokes, and you can't argue when you walk around our country and you see people, although I love people, but you see them and they're grossly overweight. They can't
Right.
sustain, they can't, doctors say, nurses say, please lose weight. And
Yeah.
can they put it together? I'm in the streets. You and I are both in the streets. They
Right.
can't, it's not sustainable. So it needs to
Right.
be enjoyable. You need to find a diet that is fun, that you look forward to, and you can't wait. You look forward to it, but it's healthy and
Right.
for you. This is going to be an incredible video. I hope millions of people
Right.
see this. Last question.
Awesome.
Let's
Yes.
go into the drugs. Hit us with the lipid
Yeah.
drugs: statins, PCSK9, Vascepa. Let's go.
You got it. So if you have plaque, you get benefit from medication. Overarching idea. The biggest impact on that plaque is lowering cholesterol with medications, and the medications with the most immense amount of mature data is statins. Do some people have problems with statins? Sure. Like all medications, they should be used responsibly. So muscle aches, some people get concentration effects. Very rare numbers of people get liver impacts. Very rare, but it does happen. So like all meds, you use these responsibly. You listen to your patient. Hey, let's try the statin. I'm aching. Oh, we're going to stop that. We have plenty of other options, right? But statins for sure have been shown not just to prevent events, but if you lower cholesterol low enough with medications, you can shrink or regress or reverse plaque. If you get that LDL cholesterol down to 35 milligrams per deciliter, about 2/3 of people are reversing plaque. It's the third way of revascularizing people. You can put a stent in, you can do bypass surgery, you can aggressively treat them medically. Third
This,
way.
you know, again, this I read in the literature. People don't know this.
Right,
People don't know it. So, is
right.
it? Can again, please? Can you lower? Can you use dietary conventions to lower your LDL less than 35? Will be the same thing as a statin.
The answer is no, because there's no data to support that. So can you lower your cholesterol with diet? Yes, that is the diet that's been pushed for decades now.
Yeah.
Is there any data to show that that dietary modification translates into less heart attacks? or strokes or death? No, there's
Wow.
no randomized control. The largest ever randomized controlled trial of diet was the Women's Health Institute study, actually. It looked at 55,000 women, 55,000, over 9 years, eating a diet that was high in fruit, high in vegetables, more whole grains, lower fat. The woman stuck to the diet, and at the end of the diet, there was, at the end of the 9 years, no difference in heart attacks or strokes or death or diabetes or hypertension or colon cancer or breast cancer. Nothing that they metriced made any difference. We have to be honest about this data and say, all right, that's not the diet, right? Move away from that. Um, so it's the job of medications if you have plaque, and then your most important focus should be LDL lowering. If statins are not enough, or if you don't get on with statins for whatever reason, there are two other classes of medications that lower cholesterol that have also proven to lower heart attacks and strokes, and that's ezetimibe and then the PCSK9 inhibitors, which are really potent, really clean side effect profile. And these medications, and especially in combination, can hammer down your cholesterol. Newborn babies are born with LDL cholesterol between 20 and 40. People have been studied with lifelong LDLs of 15. They have genetic mutations with ultra low cholesterol. So from the point of conception, through in utero, through childhood, through sexual maturation, through brain growth, through having their own children, babies, fathers, fathering children. These people have had LDLs of 15, and there is no impact on their life except they have no plaque. So we have a lot of data to support that lowering that cholesterol with medication is safe and it's effective, as long as providers responsibly use the medications and follow up with patients, because not everyone gets on with all medications. That's our job, right? You responsibly prescribe and then follow and say, how are you doing? Is it bothering you? Muscle aches, this kind of thing. And then, Tom, just to follow with that, you mentioned Vasipa, which is this medication, icosapent ethyl. This is derived from fish oil. And again, this is a very important concept. People who eat fish in general seem to do better. We talk about these blue zone diets. That is not the same as fish oil supplements or most pharmacological fish oils. And the reason for that is the active ingredients in fish oil is EPA and DHA. Those are the omega-3 fatty acids. Those are exquisitely sensitive to oxidation, which means if they get exposed to oxygen at any stage, they start modifying. And now they're not EPA and DHA anymore. They're intermediate products that are actually very bad for your health. They are peroxide lipids. And if you leave these things exposed for just hours, they start oxidizing. So not supplements, not other medications. And again, this has been studied. They don't offer any benefits. The only product there is this pure EPA called Vasipa, which is protected against oxidation when they make it, when they package it. And this has tremendous data for plaque reduction. So this is another medication that can actually reverse plaque. They showed that in coronary CTA study, and it shows a huge reduction in events, heart attacks, strokes, sudden death. So this is a medication I use a lot. Again, if I identify plaque in someone and you want to give them the best shot of not having an event, this is an excellent medication as well.
And so one of my secrets is, and that's why we're doing this, is, I call PCSK9 drugs a statin sparing drug, right?
Yeah.
So you could use less statin. I love statins. I take them
Yes.
every other day, though. I'm the muscle guy, so I don't. I'm still
Yeah.
sitting here bench pressing 400 pounds, and
Yeah.
I don't want to tear anything, and I've torn
Yeah.
everything. I'm getting older, so I still want to play like a child. I still want to be a child, I guess. And
Yeah.
so, but I don't want to have a heart attack. So you saw my recent LDL was 22, and
I know. It's
I
great.
kind of over. That's with Repatha every 2 weeks, and 10 milligrams of Crestor every other day, and Vasipa every day. So
Right.
that's what I'm almost 200 pounds, and I'm kind of a fat guy. I'm almost a fat guy. So I'm trying to work on that so I look a little better down here. But it's like
You look great. You
I
look great.
I mean, I've just got my app. I'm trying to you get this almost a
Right.
pseudo narcissism maybe, but it's like so. But it's the numbers, guys, and those are real numbers, and that's what I'm going to be publishing those, and I already teased those. And
Yeah.
it's like, guys, but I don't have any side effects, and but I don't want to be on a statin every day. So I take PCSK9. This is a secret. So it's like, it's a statin sparing. It's like using a
Yep.
biologic drug like Humira. I don't do primary care
Yeah.
anymore.
Yeah.
Humira.
Yeah. You're right.
You if you have rheumatoid arthritis or Crohn's disease and you have if you need prednisone, you could take I thought of this years ago when I was used to, now I play a doctor on TV. I was a real doctor and I was like, wait a minute. They use biologic agents to just for steroid sparing prednisones, because prednisone's a destructive drug, but it saves your
Right.
life. And if you have
Right.
Crohn's disease, if you have rheumatoid arthritis, if you have horrific asthma, okay, so you have to be on this. So this is an amazing med, but it destroys. So these meds came out where you could be on these medications and other medications that these very smart rheumatology doctors come up with and they use, and I've seen as a primary care. And I say, wait a minute. So I could cheat because I could use these PCSK9s and I could
Right.
get the benefits and I could use less statins. It's a secret. It's
Right.
expensive. I wish I wish they're going to have direct to consumer with I have a huge following, maybe 500,000, and I want to grow it and maybe these companies will listen to me and they're going to give people a break and they're going to go direct to consumer. But that's between me and them. So, but thank you, Dr. Nowlan. This is outstanding. I hope
Yeah.
everyone watches this. Thank you so much. Any closing statements for regular people, guys on with risk factors? What do you want to do?
No, Tom, firstly, thank you for having me on. I mean, I feel passionately about these messages that we've made. I mean, you're someone that gets this, and I really appreciate your platform to get this out there, because I mean, this is really important information that most people are not getting encapsulated, right? And this is people get bad advice and have wrong ideas about stuff. Uh, Again, I think my closing statement would really be to sort of reiterate, uh, you know, if you look for plaque first, that should be your first step. If you're nervous, or if you have a family history, or if you're curious, the prevalence of vascular disease and heart disease is so high, it is reasonable for almost everyone on planet Earth to get something like a calcium scan, right? So that should be your first step. And then you will understand what's going on under the hood. And then if you don't have plaque, you can feel absolutely reassured in terms of your cardiac risk. But if there's something going on under the hood, guess what? You've caught it early, and now you should take a deeper dive into those modifiable risk factors. And then you should really look at lifestyle and exercise and diet as the cornerstone of health. You should never try and do it without those things. It's really important to pay attention to those things, but those should be considered a separate intervention to medications. It's not one as a substitute for the other, or one because the other has failed. They do different things. And so let them do what they're good at, right? And don't confuse the data between the two, which unfortunately really frequently happens. So I think that's what I'd like to close with. Really.
How can you be so? I send so many patients to you. I know you're booked out. It's many months because
Right.
how can we contact? How can these guys directly contact you?
Well, Tom, I practice in Bloomfield in Connecticut. My practice is Cottage Grove Cardiology. Very shortly, we will be under the auspices of Hartford Healthcare in Connecticut, and certainly all of those will, people can find me certainly like that. And hopefully with that bigger reach underneath that umbrella, we'll be able to sort of put out more tendrils and be able to see and help more people. I mean, that's really
But these
the
guys
hope
are
of
going
this
to come.
movement.
So the world's becoming so. With the pandemic, it's been a blessing and a curse. I mean, a curse, I guess, and a blessing. That we're
Yeah,
internal medicine, we're not surgeons. So
yeah,
appropriately using telemedicine appropriately has
yeah,
really brought a lot of people together. And the
yeah,
word is appropriate. Don't blow off the digital rectal exam. Don't blow off,
yeah,
the physical exam and the blood pressure and
yeah.
listen,
You're right.
having someone listen to. I sent a guy to a colonoscopy. He's 55. He has colon cancer. His wife emailed my wife, who's my nurse, and said thank you. I mean, I said, sir, why can you just get this? And he had a beginning of colon cancer.
Wow. Good
So
for you.
you can't do a colonoscopy through this thing, right? I can't. Yeah,
Right,
and you
right.
can't.
Maybe in 5 years.
Yeah, I mean, it's just unreal, guys. And men are notorious for just looking like this. Some women
You
are
got it.
too. Not women are not completely. They're not exempt from
You
this.
got it.
But so many men are just like, hey, don't worry about it. And I want
You
that. The
got it.
younger men are different, but I really want to bring attention to that. Dr. Nowlan, thank you so much. Guys,
Yeah.
you just got to pay attention to this stuff and you got to stay in touch with your health. And I love it. Thank you so much,
Hey,
Dr. Nowlan.
Tom, thank you so much. You're great.